Hi guys, it's Whitney. Today is September 21st. I am almost a week post-op. I had my surgery on September 16th of 2015? Wow. Yeah, I just had brain loss there. Sorry about that. So I just wanted to start off by saying that I must have had a really abnormally good surgery because I watched a lot, and I mean a lot, of YouTube videos about people talking about their experience with their surgery and the problems that they had, the pain that was associated with it, the just starving for anything solid afterwards. And I have to say that I must have had a really easy surgery or something. Somebody upstairs has blessed me because I have not had nearly as many struggles as what I've learned on YouTube. I was watching all kinds of stuff to prepare myself for the surgery, and I had it in my head this was going to be the most painful experience of my entire life, and that I was going to be dealing with gas pains from hell, and I was just gonna be so ravenous by the time I was able to eat in the hospital that I didn't know what I was gonna do with myself. And it was quite the contrary. I'll have to say the scariest, worst part was the beforehand, because I didn't know what to expect afterwards. I went in, and from the first foot that I placed in that hospital, I was immediately taken care of. Everybody was so wonderful and so sweet, and just really acknowledged my fear, because that was the biggest thing. Was when I first got there, I was just so scared, and they were just chit-chatting with me and complimenting me on my fingernail polish and just totally made me at home, which was just wonderful. So yeah, my experience at the hospital was amazing. My nurses after the surgery, oh my gosh, I had to write their names down so that I could say a little prayer for them every night, because they were just amazing. I had two nurses that just blew my socks off. They were so attentive and just so funny, and totally understood when I was getting embarrassed or grossed out because I had to do something like go to the bathroom in a freaking bedpan. That was the most humiliating thing. And they were totally understood, and they were funny about it, and they were cheering me on, because I was probably one of the first ones. Let me just back up a little. My surgeon did 10 surgeries that day. And so on my wing of the hospital, there were 10 other patients that had just had some sort of bariatric surgery, whether it be the lap band, the sleeve, or the gastric bypass. I want to say most of the people I talked to had the sleeve. So that being said, there was a lot of gastric patients on this floor, and I was one of the first ones to get up and start walking the hallways. I was also the first one to leave, and a lot of the other patients that I talked to, only 3 of them that I know of got to leave the day I did, which was the day after the surgery. Everybody else had to stay for another night because they were either having complications, or they were having a lot of nausea, and they were throwing up, and they were vomiting, or there was something going on. So I attribute my easy recovery to the fact that I stuck with that plan in the beginning. I did my 2 protein shakes and my light meal for those 2 weeks before. I made sure to get in all my vitamins every single day. I was walking, I just wanted to be as prepared as I could for the surgery. And I think because I did that, my surgery went really seamlessly. So, there was one of their patients. She was so cute. She made her would race around not really race, we were just walking, but we walked opposite directions. So every time we passed each other, we're like, oh, lap 5, go girl, and we're sitting there wheeling our little IVs down the hallway. It was pretty comical. So on the first day, right out of anesthesia, I felt really good, and I was not in any pain. I had this super awesome pain button that I would hit all the time because I did not want to feel anything. And they had me on IVs. was awesome. I have never had an IV that didn't hurt, and this lady that did my IVs, she put a numbing cream first, and then she stuck me with a numbing agent. She injected some numbing agent, and then she put the IV in. I didn't even feel it. She did it on both my IVs. I had to have 2. And I was like, this is amazing. Why doesn't every doctor do this? This is so amazing. Because I can tell you right now, the IV is the most traumatizing thing ever. So, that was awesome. So, yeah, I was the day of surgery, or the day after surgery, actually right coming out of surgery, the day of, I was in bed most of the day. I did get up because I was tired of going to the bathroom in the bedpan. They are pumping so many fluids through you, you have to pee like literally every 5 minutes. And I was so embarrassed that I had to keep calling the nurse because I had to go pee. And so I was just like, can I get up? Can I get up and just go to the bathroom? And she was like, do you feel like you can? And I was like, yes, I can do this. Getting up was a little different because my stomach muscles were really tight. There was a sharp pain, you know, right on the biggest incision, which is on my right lower side of my abdomen. And that's the only incision that's been giving me pain since then. So getting up and going to the restroom, at first it was a little difficult, but it wasn't impossible. Learning how to wipe a different way, sorry to gross anybody out, that was a little strange because I'd always wiped a certain way, and then I couldn't move myself to wipe that way, so I had to learn a different way to wipe. Gross, right? So that was interesting. And then once I was able to get up and go to the bathroom, I was like, okay, I think I need to start walking around. Sorry about that, I had to answer the phone. So where was I? I think I was talking about when I first got out of surgery, I was doing pretty good and I wanted to get up and walk, and I was talking about how after I started to get up to go to the restroom, I wanted to go ahead and start walking my laps because I knew they just said, in all the videos I talked about, they were talking about how the gas pains just hurt, and when they blow you up with that carbon dioxide in your stomach, that the gas has to dissipate somehow, so that's really painful. So I was like, oh, I've got to start walking or else I'm just gonna die of pain. So I got up and I started walking, and the first couple of rounds I was like, okay, I'm ready to go lay back down for a little bit and watch some TV. And the more I did it, the more laps I would go without getting tired or just bored, you know. And so that was really good that I was able to get up and do that. You know, of course I had my little pain pump, so I didn't feel any pain. I didn't have any gas pain. I didn't feel bloated. I really didn't have any uncomfortable side effects, really. Everything went good. Everything went really good. So I wrote down a little list of my experience so far. Like I said, I didn't have any gas pains. I still have yet to have gas pains. I will tell you though, trying to drink is really difficult. I will take what I think is a sip and it still feels like it gets stuck, like right here, and I have to kind of pat my chest to make it go down. Drinking my protein shakes is ridiculously hard because they are thick. I take one sip of that and I am like so full. So, and I have to drink 2 of those a day, and it's basically 2 scoops and 8 ounces of milk or water, and I have yet to get down 2 of those a day. It's just really, really hard. Today I've only been able to take a couple of sips out of 1. On top of that, I'm supposed to be drinking 64 ounces of water. That is the equivalent to 4 water bottles. I am lucky if I get 2 down. I'm constantly sipping water. And it just, every time I take a sip, I'm like, oh good, I'm drinking more. And I look at my bottle and it doesn't even look like anything's gone. So, I've really been concerned about that because I know when they first do your surgery, your stomach is this teeny tiny little pouch and you kind of got to stretch it out just a little bit to give it some leeway. But man, it's tough, you know, and all those videos I did hear about how tough it was to get your water in and your protein, but it's really tough. So other than that, I have no gas pains. Let's see, I'm only able to get in 2 bottles of water a day. I'm able to drink 2 protein shakes a day. I try to split it up into 4. Excuse me. But like I said, I haven't been able to get anything down. The only pain that I'm having is on the lower right side of my belly where the biggest incision was. I am progressively learning how to sip and not gulp. I thought I was sipping before. This surgery gives you a whole new definition to sipping because it's not what you thought it was. It's like very little. And I'm not walking as much as I should now that I'm home. It's kind of hot here, so I don't want to go outside and get really hot and make myself sick. So I started back at work today for the first time. I had my surgery last Wednesday and I'm at work today on Monday. Granted, I didn't make it the whole day. But while I was there, I was walking laps around my office, getting up every hour or so because I'm deathly afraid of a blood clot. So at about 10 a.m. I was in a lot of pain because of the chair I was sitting in. It's not conducive to people with abdominal surgeries. My back was hurting because I was having to hunch, because if I sat up straight, my abdomen stretched and pulled on my incision and it hurt. So my back was sore, my tummy was sore, and I was just miserable. So I decided to come home. I only was there half a day, and the rest of the day I've been laying out on my couch. So then yesterday I overdid it a little bit. I went to my grocery store and I walked around with my friend to get groceries, and I thought I was going to pass out by the end of it. My stamina is not where it was, and I have to remind myself that I just had major surgery, and I'm not going to be able to do an hour H-E-B run like I normally did and walk around all through the aisles. It killed me. I was in a sweat. I had cold sweats because I was just really exhausted, and then I was in a lot of pain. So I'm having to limit what I can do and not be stubborn, as my friends call me, and just try to listen to my body and not overdo it. So that's some things I'm learning about. Some tips that I've learned with the surgery, if anybody's thinking about getting it. A really good tip you can do is to sleep elevated. I learned that when I would sleep on my back, I felt really caged in because I couldn't sit up because my tummy muscles didn't work. I couldn't roll over because I have my leg massagers on to keep me from having a blood clot in the middle of the night. And I just felt like stiff as a board and I couldn't move and I felt really trapped. Not to mention, I felt like I just had something in my throat the whole night. Whether it was, stomach acid or air or something that just caught kind of in my esophagus, I'm not sure. But it was really uncomfortable. So I've been sleeping elevated, like on a bunch of pillows. And I've also, during the day, I've been sitting on my couch elevated with my legs out with my little massagers on. So that's something new, something you can try. Another thing was that I learned from another video was to get those Gas-X strips. They're these little delicious tasting strips. So you just lay on your tongue and they dissolve and they're like breath mints. I will tell you, your mouth gets really dry in the hospital and they have these little swabs that you can wipe around your mouth to get it moistened and freshened. And these little Gas-X strips, they do that. They like freshen your mouth and they taste good and everything. So I've been taking those every once in a while. I don't feel like I have gas pain, but I just like how they freshen my breath. So that's why I've been taking them. I imagine I haven't been having gas pain because I've been taking those, but who knows. And I learned that I really like broth. I didn't think I would like broth. I've never really had it, but I really enjoy it. So that is something I enjoy and I look forward to every day, is getting my lunchtime where I get to get some broth and it's nice and warm and it feels good going down, and that's something I enjoy every day. And I've been crushing up my pills and drinking. I've been crushing them up and then putting them in my protein drink or my water, and that's been working okay. And then today I made the mistake of one of my vitamins that I take is not one that the bariatric surgeon gave me. It's one that I've been taking beforehand. It's like a hair, skin, and nail supplement, and it's really big. It's a horse pill, and when I bought it, I made sure that it was one that I could like crush up. Well, there's like some sort of waxy coating on it, so when it crushes up, it all sticks together anyways. So I've been having a hard time mixing that in water or mixing it in my protein shakes. So today I got smart and stubborn and decided, oh, what if I just cut it up into small pieces and try to take it? When they tell you no solid foods, they say that for a really good reason. Listen to them. Do not put any solid foods in your mouth at least for 3 weeks after surgery. That pill hurt so bad going down my throat. It hurt so bad, and I could feel it the entire way it went down, the entire time it went into my stomach. I could feel it, and it hurt, and I felt it scratching, and I thought I was gonna die. So, and it was little. I mean, it was just a tiny little piece, but it had sharp edges, I guess. So, I won't be doing that again. I will be grinding them up and putting them in something to drink so I can get them. But other than that, I guess I can give you my stats. I started out at my highest weight at 275. The day of surgery, I was 261. And then today, I weighed myself and I was 257. So I'm pretty excited about that. It's only been a couple of days out of surgery and I already lost a couple of pounds. And I don't remember the last time. It's been a very, very long time since I was in the 250s. I've always been over 260 for years, probably. I imagine my wedding day, I was 220. Yeah, my wedding day was 220. So when I get back down, when I get down to the 220s, I'm gonna be what I was at my wedding day, which is kind of exciting. So, and then, oh my gosh, when I get into the hundreds, I'm not gonna know what to do with myself. I haven't been in the hundreds since like junior high. So, anyways, that is what's going on with me. And like I said, I'm almost a week post-op, and I will be giving updates probably once every month. But I just wanted to give some tips for those of you who are looking to have the surgery or just out of surgery. And if you have any tips or tricks or anything for me that I could totally use right now, I would greatly appreciate it. And I guess I'll be seeing y'all next time. Thanks. Bye.